Hello, good morning, everyone. This is Dr. Khan. So I have a wonderful lady from the Northeast. She comes to me. She's 63 years of age. She has had a set of implants from 2004, the one and only saline. Now, exactly a year ago, she had the explant done where the supposed end block was done, along with removal of the capsules. Now, post-op, she continues to suffer from what are true classic, what I would say, breast implant illness problems. Now, tell us, we want to hear from you. What exactly, why are you here in Michigan?
Well, I'm here because I had an explant a year ago, and I wasn't convinced at the time that my surgeon had gotten all of the capsule, and I have felt somewhat better, but I still have ongoing symptoms, and I've had ultrasound, mammograms, and on the ultrasound there's a few findings. There's some seromas there, so I was worried about the fluid. I wasn't really able to speak to my surgeon until I let him know that I was getting a revision done, and then he got on the phone and he said that he went to great lengths to get the capsule, even though he said my capsules were very thin, and when he took them out they actually tore, but he said he went to great lengths to get the rest of it. So it was a very hard decision to come here today, but with the ongoing seromas that I have and the pain that I have and the symptoms that I have, I just felt that I needed to come see Dr. Khan and get it resolved. So that's why I'm here today.
Sure. Now, there's a lot of information you just shared with us. What are the symptoms that you're exhibiting?
I have terrible brain fog and memory issues. I would say that's my number one symptom now. I have a lot of other issues. I don't sleep well. I have really dry skin. I have floating things in front of my eyes. I have tinnitus, 24/7 screeching in both ears. I actually feel a lump in my throat as well. I've had that now for 3 years. And then other issues, but I would say mostly 20 times a day I have the brain fog and the tinnitus. It's terrible. And then I have pain. I have pain around the outside. I have pain in my breast, and it moves around. I had a lot of electrical, so I just assumed that was nerves regenerating and whatnot, but I still have this ongoing pain, and it kind of comes and goes. So I just know at this point that something's not right about that. I should be clear of that, as Dr. Khan said.
So a year out, you should have settled from any surgery, and unless, now the other thing here that's like a big red flag is the word when you said end block was done according to your dictation. Number two, there is a presumed BII diagnosis. That was the pre-op diagnosis that was mentioned by a surgeon. If you don't believe in BII, you're not going to remove the whole capsule. Now, you cannot say I did an end block and the capsule tore, because just the fact that the capsule tore, it is not an end block anymore. So that's very important. So basically, you're negating the fact that the end block was done. The other thing that's very important here is to emphasize the fact that you have seromas, because you had an ultrasound done just recently, not too long ago, in the last few weeks, that clearly shows there's fluid, edema, swelling, and this is consistent with what is an inflammatory burden left behind. And as you can see, if you just look at your breast tissue, it's more red, inflamed, with those green veins that light up, compared to the rest of the chest and the lower abdomen, consistent with and highlighting the fact that you have some inflamed tissue remaining behind. Now, the other option was do nothing, and you waited so many months for someone who's a very functional part of society, a successful businesswoman, the goal, and you decided that basically we're going to proceed. I'm going to make the incision, and whatever inflamed tissue I find, I'm going to remove, send off to pathology. Any capsule, anything abnormal, I'm going to remove and send it off, such that we basically, number one, prove that the inflamed tissue was removed. Number two, that we basically get you back to being healthy and normal and thinking without the brain fog, without the memory issues that are very much consistent with what is breast implant illness. Now, do you have anything? Now, one thing I want to mention is your plastic surgeon back home is a phenomenal plastic surgeon. He's like the king of plastic surgery, if you will. I looked him up. Again, I like to see my colleagues. Now, he's a wonderful man, a professional, a true gentleman. I did not meet him. I did not know of him, but I can see his CV and his performance over the decades. A man with a lot of reputation. And this is, again, going to highlight the fact that, this surgery is relatively very delicate. The whole emphasis and the gist of the surgery is that surgeons focus and commitment that all inflamed tissue plus the capsules must be removed such that the patient bounces back. So two things basically. Number one, we're going to see how you do 3 months, 6 months out. Number two, we're going to see the pathology report as to exactly what was sent, so that we have exact hard evidence as to what was the tissue removed and what it showed from my pathologists, so that we can compare your previous pathology report and mine. Anything you want to add, please?
No, just say a prayer.
Yes. No, absolutely. We're about to head to the OR.
This is the end of the whole thing, because it's been 17 years, and honestly, I would say from all of that 17 years, I've had some issues or other. I had a parathyroid tumor as well I had for years, which I don't know if it was caused by my implants, but it's just been a really long journey, and I want to be finished with it. So.
All right. No, thank you very much, and I appreciate you being generous and sharing your journey, so that others will basically take benefit, and time will be witness to the proof as to how you're going to bounce back, if you're going to bounce back. And I'll do the level best from the bottom of my heart. If I find any inflamed tissue, if I'm sitting on the fence, should I remove it or not, I will remove it, because if it's not sent, we won't know what it is, especially with the gel bleed and the detrimental effects of the breast implants. Thank you again.
Thank you.